Greetings, loved ones. Unreported physical abuse in the first 5 years of life has long-term detrimental effects, according to a recent study published in Pediatrics. Today we're going to talk about the health effects in adults from unreported child abuse as a child. Help us get these messages out. Please subscribe to our channel. Follow us on Facebook, Instagram, and Twitter. Hit the like button and the notification bell, and please share these messages with others. You could save a life. It has been documented that unreported early abuse can have widespread health effects in adulthood. So here's some key takeaways of what we're going to talk about. Physical abuse in early childhood can have lifelong effects, according to a study. Researchers found that children who are physically abused in the first 5 years of life are more than twice as likely, to experience a wide range of detrimental outcomes in adulthood. And number 3, early physical abuse may affect education, economics, mental health, physical health, and criminality. Unreported abuse in the first 5 years of life has long-term detrimental effects, according to a recent study published in Pediatrics. Researchers from Duke University in Durham, North Carolina, followed children from kindergarten level through adulthood. Parents were interviewed about responses to their kindergarten-age child's problem behaviors, and interviewers used this information to rate the probability that the child was physically abused in the first 5 years of life. Adult outcomes were measured based on 23 indicators of education and economic stability, mental health, physical health, and substance use. Criminal convictions also were considered. Lead author of the study, Jennifer E. Lansford, Dr. Jennifer Lansford, says, understanding long-term effects of adverse experiences during childhood is important for identifying potential intervention targets and areas that children, parents, and communities would benefit from additional sources for preventative efforts. So let's talk about the study findings. The researchers found that adults who had been abused were more likely to have received special education services, repeated a grade, received government assistance, scored in the clinical range on externalizing or internalizing disorders, and have been convicted of a crime in the past year, compared with those parents who were not physically abused while controlling for potential confounders. Those who had been abused were also more likely to report lower levels of physical health. However, there were no differences seen in relation to substance abuse. The authors of the study said the majority of child abuse goes unreported to authorities, yet those findings suggest that even unreported physical abuse in community samples can have long-term, high-impact detrimental effects in adulthood. Dr. Lansford added that children who are physically abused in the first 5 years of life are more than twice as likely as children who are not abused for a wide range of detrimental outcomes in education, economics, mental health, physical health, and criminality into adulthood. Lansford adds that although they expected to find long-term detrimental effects of early child abuse, the magnitude of the effects was notable, especially because of the study design. Pardon. Dr. Lansford explained that these were community samples with abuse that had not necessarily been brought to the attention of the authorities, and the samples were followed prospectively from childhood into adulthood rather than samples asked to recall childhood experiences which they might have misremembered. So let's talk about the child's first 5 years. The first 5 years of life are a critical time for not only physical development, but social and emotional development as well, says licensed clinical psychologist and parenting evaluator, Dr. Melanie English. As well as learning to crawl, walk, and talk, children are also learning and comprehending emotions, routines, rules, and relationships. Dr. English says they look at caregivers for love and attention to meet their basic needs. Healthy development, the doctor says, means they are building trust in the people around them and therefore in their environment, and this is an active and important process, even considered critical. It's hard to later undo these early forming views of the world which can be pervasive and persuasive over time. As adults, our relationships and world are much bigger than when we were children and include our relationships with our own children, significant others, co-workers, friends, and community, explains Dr. English. Dr. English continues saying, early childhood can create a foundation for our worldview and impinge many or all of our relationships and how we perceive ourselves in the world. So there's different types of abuse, and it's important to recognize that not all abuse is physical, but can have consequences that are just as severe. They can be emotional and psychological and could be yelling, breaking items, abusing pets, excessive discipline, or restricting food, comfort, toys, or love, says Dr. English. Dr. English says those belittling labels and predictive statements like you'll never amount to anything or you're worthless can be perceived as truth and have long-lasting implications on self-esteem and self-regulation, think anxiety. Dr. English says, for example, if a child hears over and over again that they are a loser, they will likely believe that they are a loser. Sometimes victims of abuse will explain that while a bruise will physically heal, an emotionally abusive and derogatory name or comment can linger much longer. So, how can we change things? Above anything else, Dr. Lansford emphasizes preventing physical abuse in the first place. For example, pediatricians and doctors can speak with parents about the importance of using only nonviolent forms of discipline and provide guidance on alternatives to corporal punishment. She also highlights the need for other forms of support for parents to help prevent child abuse. And for children who have been abused, early intervention is important to try to prevent entrenchment of behavioral, emotional, and academic problems that can emerge early in response to abuse and persist into adulthood. In some cases, there's a legacy of physical abuse. We are products of our childhood, and there are indeed learned cycles of abuse, even inadvertently, that parents employ for parenting, perhaps without realizing or questioning it, or because acknowledging and recovering from abuse in their past can be painful. But it's important to acknowledge that there are also parents who work hard to break those cycles of violence through counseling, resolve, and learning new parenting techniques. Dr. English says they may have confronted their past or their own parents and decided they want to stop the abuse from continuing and break away from its hold or influence. According to the CDC, over half of all the children in the world, that's 1 billion children ages 2 to 17. That drives me nuts. 1 billion children will experience violence every year. The question is not if you will encounter a victim of violence. The question before God is what will you do when you do encounter them? You could be the person who saves a life. Micah 6:8 says, God has showed you, O man, what is good. And what does the Lord require of you? To do justice, love mercy, and walk humbly with your God. You are called. We are all called to be champions for justice. And if you're a victim of violence, listen to me. I want you to know you are valued, loved, and intelligent. And yes, you are worthy. I want you to know that there is a way out. You're not stuck, and it's not your fault. Abuse is not love, and most of all, above everything, I want you to know you're not alone. If you are suffering violence, please reach out to somebody today. If you know of a child or other person suffering violence, tell the authorities. In our next episode, we are going to begin a series and dive deep into the subject of psychological abuse of children. Until then, God bless you.